Hello, welcome everyone. Thanks for joining us for the HTI-1 final rule and in-depth analysis of recent changes. My name is Lisa Palmer, and I'm the Vice President of Research, Innovation, and Development at Drummond. And I'm here with two of my colleagues, Bob Bryan, Senior Director of Advisory Services, and James Threet, Director of the Drummond Test Lab. Together, we will discuss the HTI-1 final rule, its impact on development timelines, important compliance deadlines, and what you can start doing right now to stay ahead. Please feel free to engage with us throughout the webinar. If you're watching in Vimeo, use the audience chat function on the right-hand side of your screen. If you're watching on LinkedIn, you can use the comment section. If you have a question, just pop it in the chat or comments, and we will do our best to get to it during the Q&A at the end of the presentation. So let's jump right in. Taking a look at our agenda for today, we are going to review the HTI-1 final rule key changes, important deadlines and recommended timelines, the Decision Support Interventions Rule, DSI, G10 Fire API requirement changes, the USCDI v3 requirements, insights reporting requirements, electronic case reporting changes, and patient-requested access restrictions. So we have a lot to talk about here. Bob, I'm going to start right off with you. What do you see as the big areas that changed in the HTI-1 final rule?
Yeah, as I think as everyone could see from the agenda, there's a lot in the rule, and I wish I could tell you that that's everything. But it is the big areas, the big rocks that I think are in front of developers in the coming couple of years. And a lot of you looked at the proposed rule and saw what was proposed there. And then now the question is, what really changed as ONC moved to the final rule? And so the big things that I'd highlight, first of all, a lot was stacked on deadlines that were coming at the end of this year in the proposed rule. Some of that changed, particularly the USCDI version 3 deadline. That was moved out to the end of 2025. And that was a good move by the ONC. I think they listened to feedback that they had received from developers about everything that looked like it was set up for essentially a one-year run in 2024. So now it's really a 2-year window that allows developers to develop a plan over the next 2 years to cover some of the deadlines that hit in the middle of that 2-year window, and then others that will be coming at the end of the year. USCDI in particular, is somewhat heavily integrated into a lot of functions and a lot of certification criteria. So it's good to have this 2-year planning window. The DSI rule was another area where there were significant revisions, but the deadline didn't change. And this is the key rule that has a deadline at the end of this year. And from what we've heard, this is a part of a broader initiative across the federal government for regulation, particularly of artificial intelligence, which is a key thing that came in with this rule, is AI-based or predictive DSI. Those definitions aren't completely aligned, and we'll get into the definition of predictive DSI as we discuss that. The key thing to understand is that this rule still has a deadline at the end of the year, this year, and there was some narrowing of the rule in terms of who it applies to. So we'll get into some more discussion of that. And the last one I'd mention is the patient-requested access restrictions, so the ability of a patient to submit a request. And there was a scope change in terms of on that rule that kind of narrowed the functionality that's required. So we'll discuss that some more too.
I think those are great key changes to highlight, Bob. James, over to you. Could you maybe provide some more detail about the compliance deadlines?
Sure. So the timeline, as Bob mentioned, is kind of short. This year, the changes to G10 and are going to be taking effect. At the end of the year, it's going to be B11, Decision Support Interventions. And then, as Bob mentioned, USCDI version 3 is not going to be required until the end of 2025. So the additional time will, I think, is much appreciated across the industry. And then finally, 2026, 2027, we'll start to see the insights reporting. And we can talk more about that in a few moments.
And I think there's a couple key notes here. There was some new guidance that came out if you're on the ONC's mailing list. Key guidance that came out both on the G10 related deadlines and the deadlines around code sets. So it's worth reading that, and we'll talk a little bit more of that as we get into those details. But basically, it looks like there's an expectation that some of the G10 updates either are already in place because they're not as significant as some other requirements, but they do apply this year, and developers will need to work with their ACB around managing when those updates go in and when they can attest to them. And James, I'm guessing that there'll be more guidance coming on that.
Absolutely, yeah.
Yeah. And then the other note I would make is that the first insights requirement, the phase 1 requirement, does come in at the end of 2025. There's 2 more phases after that, and we'll discuss insights a little bit more as we get into this.
Mm-hmm. Yeah, definitely. And I know one of the topics that has come up or been mentioned already a couple of times is decision support. And that was probably one of the biggest topics of discussion in the rule, particularly as it extends into artificial intelligence and has a compliance deadline of this year. So, Bob, I'm going to let you dive into that a little bit. And can you give us an overview on what's in that new rule?
Yeah, this is an important one, particularly as we mentioned, because it is the criterion that has a deadline at the end of this year. The big change that comes in this rule is the definition of a new category of decision support. The rule, the former rule A9, clinical decision support, will shift to the new rule B11, which is now called DSI, or Decision Support Intervention. And the big component that's been added to that is predictive decision support. So it's worth talking about how they're defining predictive decision support. And the ONC has emphasized their definition, which is specifically in the rule, as a 3-prong test. So the first prong is supporting decision-making based on algorithms or models. Secondly, deriving relationships from training data. And then third, resulting in prediction, classification, recommendation, evaluation, or analysis. And really, it's probably the second prong of this test that really distinguishes a lot of decision support and makes it predictive. It's the use of that upfront training data to derive relationships and ultimately drive the prediction that's being done, the actual decision support that's coming. So we expect to be working closely with customers to determine what capabilities that they have will be within this definition, because the key thing about the rule is that it drives some different requirements for different DSI.
Mm-hmm.
So the 2 types of DSI that are now covered, as I mentioned, one is predictive and the other is evidence-based, which is really what customers were used to managing under the former A9 rule. So the way these rules will work is it's much like the switch from G8 to G10 that developers were familiar with a couple of years ago, in that as of the deadline at the end of this year, if you want to stay certified for clinical decision support, you're basically moving from the requirements under A9 to the requirements under B11. And there are a number of requirements that will apply across both types of DSI. This is not an exhaustive list here, but I'd emphasize kind of a couple things. Enabling selection of DSIs is required for both types. There is a distinction that comes up later in the rule, which is very important, and this was the reduction in scope that the ONC did. The proposed rule had said that if you interface with predictive DSI, then additional requirements apply to you as a developer under the rule, particularly risk management requirements, which we'll discuss a little bit more in a minute. They eliminated that interfaces with language and replaced it with supplied by. So, and that was a good recognition by the ONC that what EHR developers really have control over from a risk management perspective in particular is the predictive DSI that they supply to their customers, not necessarily everything they interface with. So there will still be a lot of DSI that EHRs interface with. That will be decisions probably made by their customers. And the EHRs need to enable the selection of that. And there are some additional source attribute requirements around that as well. And one area where there's another distinction on whether the DSI has been supplied by the developer is the requirement for plain language descriptions. And that applies to both types of DSI under the rule. And then the third thing that's important is that real world testing will apply to the B11 rule under the B11 rule going forward. Essentially, all the B criteria are part of the real world testing program. And now that this area has shifted from the A category to the B category, it will come into the real world testing space. James, do you want to talk a little bit more about that?
Sure, yeah. So real world testing obviously is affected. A9 was not in the real world testing requirements, but B11 is. So developers that certify B11 before August 31st will be required to include a B11 real world test plan in their submission this year. That's not to say that you cannot do it. You can certify B11 after August 31st and still conduct testing on it next year. So you would just add it to your results in 2026. So there is still that opening to do real world testing. It is probably a smart idea to get started on it. You know, this DSI has some pretty big complexity and determining what the interoperability functionality, how well it's working is possibly going to be a challenge. So it's a good idea for vendors to start thinking about it. And even if you don't have B11 certified before August 31st, you could voluntarily include a real world test plan for A9 that will kind of lead into what you're going to do for B11. I know Bob and the Drummond advisory team has been working with customers on that. And so I think that's a good way to get ahead of it.
Yeah.
Yeah, it's not a strict, we saw this again with G8 and G10, and a lot of people were certifying after August to G10. But then they got into the next year where they were actually managing their real world test plan, and they looked at it and they were saying, well, we don't have G8 in place anymore. We're certified to G10, so we'll go ahead and real world test that, even though it wasn't specifically required. And it'll be a similar situation between A9 and B11. If you become certified to B11 after August of 2024, I don't know if you want to real world test A9 In 2025, you may want to real world test BLE, and possibly there'll be some additional guidance on that.
Mm-hmm. Well, and I think, you're speaking there, Bob, to some experiences you've had in the past in the advisory team and what you've seen. I would like to ask you specifically for predictive decision support, what areas do you see the Drummond advisory team consulting with customers about?
That's a good question, Lisa. Thanks. So this is a fairly deep area. It's a long rule. So I would say, one area we'll be working on is this ability to select both types of DSIs, which really adds the predictive DSI capability, even though many developers won't be supplying predictive DSIs, and they're not required to. But what level of support they have to be able to select these DSIs. And then secondly, there are significant differences between the source attributes that need to be supported for predictive DSIs. It's pretty much all the source attributes that apply to evidence-based DSI, plus more that really provide a lot of information that drives into risk management and provides transparency on what the predictive DSIs are doing, and how risk has been assessed on them. A third area is the specific requirements for DSIs that are supplied by developers, which trigger a conditional requirement for a risk management program. So we'll definitely be working on that. And then lastly, related to that risk management program, there is a publication requirement that applies to the risk management program. You have to publish a summary of your risk management practices, and there are some specific requirements around that. So this is another publicly accessible hyperlink that developers are going to need to provide, much like they do with their real-world testing reports. And it will depend on whether they're supplying predictive DSI capabilities to their customers.
Mm-hmm. Yeah, that makes a lot of sense. This is a big requirement for folks. Another one that we talked about a little bit earlier had to do with G10 and changes that will be needed for that requirement in 2024. James, I'm going to go to you on this one. Can you comment on those?
Yeah, there's two significant changes to G10. So the first one is regarding access tokens having less than 1 hour until they expire. This was clarified a while ago, but in this time around, it's actually being added to the regulations so that it's explicitly allowed. There is a slight change to the test procedure due to that if developers are using that method. The other method is to just be able to revoke the tokens manually per the test procedure. Note that refresh tokens, there's no change to that. It's still a 3-month expiration at minimum. You can offer less or more time, but you have to offer at least a 3-month expiration. So the tokens is not going to lead to a major change for existing certified products. You're not going to need to attest to it. You're not going to change your access token functionality if you don't have it this way. This is if you already have it as a 1 hour expiration and you want to just make sure that that's clarified and is explicitly allowed. The second thing that's changing with G10 is a condition of certification, which is the service-based URL. Developers are required to maintain a list of endpoints for FHIR servers that patients can find their provider and know where to get the data from. So the clarification that came out in HTI-1 is actually very helpful because it not only identifies a standard that's going to be used for service-based URLs, but also establishes a method of monitoring service-based URL. So there is a site called Lantern healthit.gov, which is where the service-based URLs are being monitored. And so I would recommend, that developers bookmark that page and check it from time to time, make sure that their endpoints are all up and running and that they have a good uptime. The second part of that is going to be, the hearing from your ACB about those. And if there's an issue, your ACB will reach out. And there's some other specifics around exactly how that service-based URL is. Like, for example, the organization, instead of using the US core version, it's actually using the Fire R4 base version of the resource. So there's less constraints. And so the standard that's going to be required is going to be for the end of this year. So developers should, take a look at that service-based URL update and plan for whatever changes that need to be made by the end of the year. So I see a question about that. Your URLs on Lantern are actually taken from your chapel listing. So if you need to update your chapel listing, reach out to the Drummond certification body to make that change, or to your account manager.
Yeah, that's a good clarification. Bob, do you have some other thoughts on some of these changes with in this area?
Yeah, specifically on the service-based URLs requirement, which is a condition of maintenance now. The inclusion of that organization data is an important component, and it's specifically listed in the maintenance requirements. And this applies across essentially every customer implementation that an EHR has, whether they're centrally managed or locally managed. Key policy here is to just make sure that the customers, the patients or others that would want to access these APIs can find them and know which organization they're reaching and how they can get access to that particular provider's data.
That's right. Yeah. And just to add to that, so it's only the patient-facing URLs, not the bulk data, not the other ones. It's just the ones that patients will need to access to get their records out.
Mm-hmm. Absolutely. Now, looking at some other standards here, and specifically USCDI, that's another big area that intertwines with multiple requirements. James, can you talk a little bit about the effects of the USCDI version 3 updates?
Yeah, so USCDI is going to be adding additional data classes and data elements on top of what vendors have already certified with USCDI version 1. So that contains like new SDOH data elements, as well as removal of 3 clinical notes types. So this will lead to additional development work for this year and next year to improve the CCDA functionality as well as the Fire API functionality. So this could potentially be a pretty large lift, depending, and especially if your systems are not already capturing these data elements. So like the SDOH data elements. So I would take a look at that as soon as the new documents, so proctor sheets and the certification companion guide and test procedure. We're expecting those to be released by ONC next month, but we're hoping to get some additional clarification from ONC to the Drummond group next week, and then we can pass on, what we've learned. And so note that as far as updating the documents goes, ONC has removed the 2015 edition title for this program. Like, the entire program is going to be changing. So all of our documents are going to need to be updated with that. So expect to see a series of new documents this year, obviously in the first part of the year. And then we will definitely let everybody know when those are ready, though. So,
yeah, that name change was a good clarification, I thought, by the ONC because it eliminates this connection to 2015 when we now have a program that's extending requirements all the way out to 2028. So why have it tied to that 2015 year?
Yeah,
Yeah.
that will be a clear change. That will be nice.
Um,
Um,
The
oh,
code
Bob, did
sets
you
was
have
the
anything
second
else?
one. Yeah, the code sets is the second part of it. So the way that it was written, I think in the final rule, was it almost seemed like developers needed to update their code sets by the effective date of the final rule, which is February 8th. So it hasn't happened yet. ONC just issued a clarification saying that code sets are not required to be updated until the USCDI version 3 updates are required, which is the end of 2025. So, in other words, developers will have until the end of 2025 to update to the 2022 code sets. You are allowed to go ahead of that, so you don't need to use what's in the regs. You can use a newer one, but the baseline is going to be the 2022 by the end of next year.
Okay.
that's a good point, James. And in looking at the way they set up the rules with all of these changes, um, the for all of the different standards, and particularly the ones that relate to USCDI version 3, both standards are available to developers now. And it doesn't even look like you have to use the SVAP program in particular. It's just that you can operate under the current standard or the new standard that will apply at the end of 2025. So it gives developers good flexibility to choose. Um, and then I wanted to mention specifically the interrelationship with the DSI rule, because for developers, I think there's a decision that they need to look at, which is that they've got a deadline for DSI at the end of 2024. And then they have a deadline for USCDI and other standards compliance and code sets by the end of 2025. So in the source attributes for DSI, it's specifically referencing the USCDI standards. So in terms of planning your development and rollout of DSI, I think you need to make a choice as to how you want to tie in your compliance with USCDI version 3. So you could roll out USCDI and just focus on the specific requirements you need to meet for source attributes under USCDI version 1. Or you can, and then you would need to do something the next year to update how you're handling source attributes with DSI to make sure you're up to the version 3 level. I think there's some more devils in the details of this particular decision for developers, but I wanted to just highlight the interrelationship between these two and the importance of looking at the source attribute requirements under the DSI rule, and then how that ties in with USCDI going forward with two different deadlines.
Yeah, that's a good clarification, Bob. I do want to switch our focus a little bit to insights reporting, because this is a new condition of certification for some developers. So, Bob, I'm wanting you, if you could, to talk about this new reporting requirement and how it applies.
Yeah, great. So first off, I wanted a lot of people ask the question about insights reporting. What is it? I already do real world testing and I submit those reports. What am I being asked to do now with insights reporting? And the way I distinguish it between these two types of reporting is that real world testing is intended to show that you have the capabilities that you're certified to. In that sense, it's like QA testing. You're confirming that these capabilities are working as expected, and you're showing that to the ONC in your report by submitting data that shows you've actually had successful transactions that demonstrate the capabilities. Insights reporting is different. It's really providing metrics across complete annual periods to show the volume of usage typically and who is using your capabilities. So you're not really, while real world testing has a period of time, you're not really trying to gather comprehensive metrics across that entire year. You're just gathering enough to fully demonstrate that your product is working the way it's supposed to. But the metrics under insights reporting are designed to give the ONC specific usage metrics across the entire year. Second important point is that insights reporting doesn't apply to everybody. It specifically applies to larger EHR developers. And the metric that ONC is using for this is whether you have over 50 hospital customers or over 500 clinician users. So that's what that baseline will trigger whether you're required to do insights reporting. And certainly some EHR developers that may be below that baseline now will need to look at whether they'll be at or above that 50 or 500 user baseline by the time insights reporting comes in. It is being phased in over 3 years, and the first collections period will start at the beginning of 2026. So that annual period from January 1, 2026 to December 31. The report for that period then will be due 6 months later in July of 2027. So just the last thing I'd say is looking at this first reporting year, there are some very specific requirements in terms of the metrics that you'll need to report, and we don't have time to get into great detail on this now, but it really gets down to specific individual numbers of unique individuals that are using certain capabilities, numbers of distinct deployments, specific applications that are connecting to your APIs, with various sub-metrics in each of those categories. So this is a deeper area that's going to require some upfront development in order to be able to start collecting, again, right at the end of this 2-year window where there's a number of other requirements coming in. And then to be initiating that collection of all of that data so that ONC receives full metrics in these reports for the entire annual period. And then, of course, there is two additional phases that will add on to the scope of the reporting that in the following years.
Mm-hmm. Yeah, that's sure to be some interesting data once this gets rolling. You know, I'm also interested in James covering the public health reporting criteria that changed. I know we saw some changes there. If we pivot over to the F5 criteria, you know, James, what would you highlight about this?
Sure. So previously, F5 was electronic case reporting. So in case of certain conditions, you would send a report to wherever public health registry was set up to accept that. Now the changes are going to be expanding those use cases and add some additional standards. Before, there was no particular standard required. Now it's going to be CCDA or FHIR. Using trigger codes, which are the different conditions that need to be reported, like that are very communicable or also need to be tracked for whatever reason. So creating the report, but also receiving, consuming, and processing those reports is the major new functionality required here. So, and I just wanted to note that this F5 electronic case reporting became important, particularly after COVID, because the functionality to report a new COVID case was in some cases like being sent on paper, on fax machine, whereas now this will make it a much more efficient process. So it's an improvement all the way around. So I'm looking forward to that. It's still not going to be live tested, so you will still attest to it. But when you are setting up for those standards, there are some resources for you to use there. For example, if you're going to do the CDC fire now ECR, then you'll be using the AIMS test tool. So, and then just attesting to Drummond Group. So,
And James,
yeah.
I know that it's been more recent that developers are choosing to certify to this rule. What's led to that?
Yeah, so with COVID, reporting those cases became an important thing. The other thing that's required for ambulatory EHRs, which this is immunizations, which, reporting vaccines also was important for COVID. So these are new requirements, through CMS, but also different states and other entities have made this a requirement that case reporting is done electronically and in real time, in effect. So it will assist public health agencies to monitor and track outbreaks and different conditions that are coming up. So.
Well, that definitely sounds like an improvement, as you stated. Some much needed advancement there. We have time for maybe one final area that underwent some changes in the final rule, and that was the capability for patients to request access restrictions for their data. So, Bob, can you maybe provide some highlights for us to wrap us up on these requirements about what happened here with E1 in this rule?
Yeah, I can cover this fairly quickly, and then we can get into some questions. So in the proposed rule, there were changes to E1, and then there was a new rule, proposed rule D14. The main change in E1 is to require internet-based capability for a patient to request a restriction on access to their data. And this really aligns with the HIPAA privacy rule, because there's a requirement that's been in that rule for quite a long time. So I think of this as operationalizing that request process in EHRs. And then D14 was proposed to apply some more detailed requirements around management of these requests and tagging data and such. They decided not to adopt that portion. So the key requirement here, again, within this 2-year window, is to enable this request process. And then providers are still left with determining, based on HIPAA privacy rule requirements and any other compliance requirements that apply, how they manage those requests. But ONC is not specifying that in this rule. They're just asking EHRs to implement the internet-based request process so that requests can come in. And then both EHRs and providers may decide whether they want software-based functionality or not, but those are product management decisions at this point for EHRs, and then process decisions for providers as they move ahead in managing the request process.
Sure. All right, well, we have covered a lot today, and it feels like we've really only scratched the surface. But I'm going to ask you, Bob, to just let us know, what are some of the programs Drummond Advisory Services could provide to help support customers in their work toward HTI-1 compliance over the next 2 years and beyond?
Sure. So Drummond Advisory Services provides specific programs for the major components of HTI-1. And then key areas we'll focus on early are both DSI, because it has a deadline this year, and USCDI. We built development accelerator programs with tools that we're providing to developers to move ahead quickly with their planning and implementation of these bigger changes. In addition, we provide a more comprehensive and flexible program, either quarterly or annual based, where we can augment development teams and basically address any requirements, including the big ones, DSI and USCDI and code sets, that they'll want to work on. But we expect some developers will have a better handle on those and will want to focus on other areas. So we can work with developers across all these areas on a quarterly or annual or 2-year planning basis on multiple topics through our certification lifecycle management service. Any developers that want to discuss further and determine what particular need areas, I'm happy to consult with you, and you can use the consultation link, the QR code that's on the page below and other pages, and I'd be happy to talk anytime.
Great. Thanks, Bob. Now, last, before we start the Q&A, I do want to mention that this year is Drummond's 25th anniversary, which is very exciting. We have some special activities planned to celebrate, so stay tuned, folks. Now, with that, we will switch gears and move into some Q&A. We saw a lot of those coming in throughout the talk today. We're going to try to get to as many as we can, but we likely won't hit them all, so we will connect with you personally to follow up if we do not get to your question. All right, with that, let me move over to some of those questions. First one to start off with, we got a lot here about predictive DSI, not surprising. Someone was saying, how do we meet the certification criteria requirement to demonstrate predictive DSI if the EHR does not deliver it? Bob, can you just clarify how they would meet that requirement?
It's probably a longer answer to that question, but there's a requirement to support it, essentially from an integration perspective. And I think there are some different models for that. I know the ONC presented on CDS hooks a few months ago, which I would recommend that presentation. It was quite an interesting, and they had a whole series of presentations on DSI over the last 6-8 months, which are worth looking at. Mm-hmm. And the key thing is that if you don't supply DSI, you still have some requirements to support it, and there's a deeper look that you probably need to make around how you specifically support the source attributes, and some of the other data management requirements for those source attributes in the rule.
Mm-hmm. Okay. All right. Thank you. Another one here is the user said, we have been told that there is a February 7th deadline for the 1-hour expiration to a test, but it sounds like this is only needed if that is your current model. Can you clarify the deadline? James, Bob, are either of you able to answer that one?
Yeah, so the rule doesn't take effect until February 8th, so I'm not sure where that February 7th date comes from, but this is only a change to the test procedure explicitly allowing this method of 1-hour expiration. It doesn't require anyone to make any changes or do any kind of attestations. It's simply just to clarify the test procedure to show that there's a different method to solve that same requirement.
Mm-hmm. A couple things about USCDI here. Someone was asking how would vendors really implement USCDI data required for B11 if that isn't required yet, sort of that distinction there. Any thoughts on that, Bob?
Yes. So you can move to USCDI V3 as soon as you want because you can follow either standard under the rule. But as I kind of was discussing earlier, it becomes a development decision in terms of how you want to roll out DSI. Um, there are certain types of data that are required source attributes, but what that rule tends to do is refer back to, I think it's 170.213, the standards provision, which is the criteria are in 170.315. But because it refers back to 170.213, if I have that number right, in that part of the rule, it will list both standards, and there's just one standard, the V1 standard, that expires in 2 years. And then there's the second standard that doesn't have an expiration date on it. So they're both available to developers, and you can determine the development plan you want to follow in terms of how you incorporate V3 requirements into your DSI implementation and when you do that. But I think there's more devils in the details of that as well. But I think that's an important area for developers to look at, is what development plan is going to work for them as they roll out DSI and bring USCDI into the picture at the same time.
Sure. Okay, thank you. Looking at insights reporting, there was some questions on this. One of them being is the 5,500 right numbers, those baselines. Is that just providers that attest or all that use the EHR? Do we know if a clarification has been made on that, or if they specify if that's those who attest or all users?
I don't think we have any specific guidance on that, and the rule just refers to the number of users that the EHR has. So I think under the plain language of the rule, it looks like it would be the total user base. But perhaps there will be a clarification on that.
Okay.
But right now, I mean, it looks to me like it's the total user base.
Okay. What is the deadline for the patient requested access restrictions?
That's end of 2025.
End of 2025. Okay. Another question was, what does consume and process mean for the RR report?
Well, that's a good question. I think until the test procedure, or at least the certification companion guide comes out, I'd like to get back to you on that one.
Sure. Okay, we can take that as a follow-up.
I do think on that, it looked to me like consume and process as far as trigger codes go. I think that's intended to enable new trigger codes to be pushed in to EHRs so that public agencies can trigger additional elements of reporting metrics that they need. The consume and process piece that applies to DCRs, I think there's information in the broader guidance document, the big 900-page document that was released with HTI-1, but I'd be happy to look into that and follow up with the person that submitted that question.
Okay, that sounds great. Someone asked, can you explain SDOH data elements a bit more?
Sure. Let's see. I'll just load up the USCDI. So SDOH are social determinants of health. And so those are designed to identify certain factors which would have effect on health. Generally socioeconomic, things like, do you feel safe at home? Do you have trouble finding food or limited access to food, and things like that. So there is some work being done with like I think it's the Gravity Project, but it has been added to USCDI. You can see the progression. It was added USCDI version 2. It's being uh, added on even more in the USCDI version 3, and so on. So this is an important policy goal for ONC to add some kind of way to track this and maybe, try to understand and get some insight into it.
Sure. All right. Thank you for that. Um, Going back to DSI, someone had asked, can you provide the vision of how providers can add their own predictive DSI? Bob, can you speak to that a little bit about what's the vision there behind how providers would be adding their own DSI in?
Yes. So the I I am not sure about the scope of predictive DSI that's being developed by EHR developers versus being developed by providers in other areas. But I know from discussions I've heard that predictive DSI is being developed in clinical trials, much like other types of clinical trials take place. So, there was a speaker from Duke University at the ONC annual conference who was talking about development that they were doing. I think there were third parties that are focused on predictive DSI modules that might be purchased by providers. And because many of these predictive DSI modules can be focused on very specific clinical needs, it looks like many will be developed in those settings as opposed to being developed by EHR developers. So, I mean, certainly some specialty EHR developers may focus on specific clinical requirements that they want to build predictive DSIs around. And obviously some bigger ones will do it too. There's also a distinction, and there's a good graphic that the ONC provided that shows a variety of administrative DSIs. One that commonly comes up are no-show applications that can assess whether patients are likely to be a no-show for an appointment, does use USCDI data, falls under the rule. And some of those administrative types of predictive DSIs might be more likely to be implemented by EHRs. And then the other category is clinical predictive DSIs, which might be implemented more commonly, I'm not sure, but possibly more commonly outside of EHRs. And then the other thing I did mention earlier, some of the presentations that the ONC did over the last year, they get into those different use cases and some of the integration methodologies that are out there for predictive DSI modules.
Mm-hmm. Sure. All right, I'm going to do one more question for us. Someone asked, can we go ahead and implement USCDI version 4 instead of version 3?
Yeah, you could. The problem is that USCDI version 4, correct me if I'm wrong, has not been approved for SVAP yet. So
I think it's in the process now and is expected to, if it's on the same schedule as last year, then it could be approved this summer and effective in early September.
Right.
So if it follows that same schedule, I think a developer could be moving towards version 4 now, and may not be able to take it into production if it modifies version 3 before early September of the year. Mm-hmm. So that's a bit of a crystal ball look, but really the ONC is on a cadence now of bringing new versions each year. And I know USCDI version 5 just came out for comment, I think, from ONC in the last couple of weeks.
Okay.
Yeah, let me also add that so there is not a test tool currently for USCDI version 4 for either CCDA or FHIR. So if the SVAP process is followed with that this year, then you can expect to be able to attest in September, but the test tool may not be available until later than that. So that's kind of the usually the rate limiting factor in jumping ahead to newer standards is that the resources aren't yet available. But yeah, you could do that, and then wherever there is a conflict between USCDI version 3 and 4, um, you would need to err on the USCDI version 3 side, well, at least for certification. So you could conditionally implement USCDI version 4 then, and in all the ways that it overlaps with the USCDI 3, and you could even attest to that now. So version 3 you could certify now, but version 4 you'll have to wait until probably Q4.
Sure. Okay.
Yeah. It's the crossover where there are conflicts, like if the next version eliminates a particular data element, you might need to retain that to be compliant with USCDI version 3. But if it's just additive, then you're probably okay.
Yeah, and I think I saw a question about which of the clinical notes are being removed. So that's like the lab note, the diagnostic imaging, and the pathology report. So those they didn't actually have link codes that we could test for two of those, and so thankfully ONC has taken them out.
Yeah. All right. So there was the reason for that. All right. I'm going to wrap us up for today here. And I want to thank you, James, and thank you, Bob, for providing your insights to us. Thanks to everyone for making time in your busy day to join us today. Later today or tomorrow, you will receive a link to the recording of this webinar via email, along with some other helpful resources. Before we log off, I do want to share just a couple more things that I think will be helpful to you as you move forward. As stated in the HTI-1 final rule, EHRs that supply predictive DSI solutions or modules are subject to a risk analysis. The Drummond team can help you develop risk management programs to achieve compliance with ONC requirements and can provide other risk assessment and cybersecurity services. You can contact advisory services at drummondgroup.com, and we can help you determine the right program for your needs. You can also register for a webinar we have upcoming on February 8th called Artificial Intelligence, Mitigating Risks While Maximizing Efficiency. And this will help you learn about risk assessments and their critical role in system development. To register, you can visit our website or scan that QR code on the screen. With that, I hope everyone has a wonderful day, and we look forward to seeing you soon. Thanks, everyone.
Thanks a lot.
Thank you.